Welcome back. Joining us this morning from Gundersen Health System is Dr. Benjamin Parsons to discuss what's called precision medicine. Dr. Parsons, thanks for being here.
Brittany, thank you for having me, and thank you for inviting me to speak on a topic that's dear to my heart.
Yeah,
Precision medicine in cancer care is a very unique way to approach cancer. You need to understand a little background about cancer to be able to understand what it is that we're trying to do. And to understand that cancer is basically a different cell, a gene that has changed in a cell to make an abnormal a cell that grows uncontrolled. What we're trying to do is we're trying to understand that genetic change and then use a targeted therapy to direct the treatment for patients on an individual basis.
Okay, so how exactly do you do that? What kind of tools are you using?
So we're looking at the genes that actually drive the cancer. It's a platform called Next Generation Sequencing. I'm the site director for the precision medicine efforts here at Gundersen, and we've created a statewide effort called the Precision Medicine Molecular Tumor Board, where we review that next generation sequencing data, the genes that are driving an individual's cancer, and we try to use that information to direct the therapies for the patient.
Wow, it sounds very intricate and complicated, and you mentioned you started this program here at Gundersen and now it's nationwide?
So this program was started in September of 2015, so it's only a little over 6 months, and it's statewide. It's a collaborative effort between ourselves, University of Wisconsin Cancer Center, and multiple other cancer centers across the state, including Marshfield Clinic and Green Bay Oncology.
Okay, and so far in the just recent 6 months, what have you guys learned? What kind of progress has been made?
So what we're doing is we're actually obtaining a platform of information about a patient's individual cancer, which is very different from what has classically been done. Classically, we've known a breast cancer comes from the breast, or a pancreas cancer comes from the pancreas. What we're doing in this group is we're actually trying to look at the genes that are driving the cancer. And what we know is that there are specific genes that we can target. Like in lung cancer, there's a specific gene called the EGFR gene that has a very specific drug that you can use to target that gene. But we know that those genes can also be present in other cancers. And so there are multiple therapies that are approved for a specific type of cancer. And what we're trying to do is use those therapies that are already approved for a different indication, a cancer that has that gene that is maybe arising from the breast instead of the lung where it's already approved in.
Okay, so maybe this precision medicine can in turn help figure out what kind of treatment, more precise treatment, and help people get the right care that they need.
Exactly. And so there's been a lot of information that's come out, and most recently in June of this year in our large cancer conference in Chicago, some abstracts were presented that showed that this approach may be more beneficial than the standard approach of using chemotherapies that are not necessarily the best choices for people. But the very key piece is that we're using this platform only in patients who have incurable cancers, who have exhausted all standard cancer treatments. And so this is still considered to be not the standard of care, and we're only using it for patients who have exhausted all standard of care options. So while very promising, this is still something that we're optimistic will provide benefit for our patients here locally.
All right, Dr. Parsons, that's all the time we have this morning. Thanks so much for being here.